This brief onboarding session is designed specifically for our ancillary and environmental services staff who may need to enter vivarium areas as part of their duties. Whether you're here for maintenance, environmental services, or facilities-related tasks, this training will help you understand the basic health and safety expectations when entering spaces where research animals are housed. We recognize that your work is essential to the success and safety of our facilities, and it's important that you are informed and confident when entering vivarium zones. We'll cover key topics such as potential health hazards, how to protect yourself, basic hygiene practices, and emergency protocols, all tailored to your level of exposure and responsibilities. Our goal is to provide you with the foundational knowledge and confidence you need to safely enter and work in animal research environments, even if your role is only occasional or support-based. We'll cover four main areas. First, understanding the health and safety risks in animal research areas, such as allergens, zoonotic diseases, and general biohazards. Second, learning how to properly use personal protective equipment, PPE, to reduce your exposure to these risks. Third, knowing how to report incidents and when to reach out to occupational health services. We'll walk through the process together. And lastly, we want you to leave today feeling prepared and empowered to start your work safely, whether it's changing filters, delivering equipment, or cleaning spaces. We know your time in the vivarium may be limited, but it's still essential that you know what to expect and how to protect yourself. So, why does occupational health matter in this setting? When you step into a vivarium or animal research environment, you're entering a space with unique occupational risks that you may not encounter elsewhere on campus. These risks can include allergens from animal dander, zoonotic diseases, which are diseases that can pass from animals to humans, and even sharp instruments used during animal procedures or cleanup. Your safety is important, but so is the well-being of the animals. When we take steps to protect your health through proper hygiene, PPE, and protocols, we're also preventing the potential transmission of pathogens to the animals, which could compromise the research or the animal's welfare. This training is not just about internal best practices. It helps us comply with important regulations and guidelines from OLA, OSHA, AAA-LAC, and our own institutional policies. Ultimately, occupational health is a shared responsibility, and your role, no matter how brief or behind the scenes it may seem, plays a vital part in keeping everyone, human and animal, safe. Now let's talk about personal protective equipment, or PPE, which is one of the most important parts of keeping yourself and the animals safe. When you enter a vivarium, you'll be expected to wear certain PPE, depending on the area you're entering and the type of work being done. At a minimum, this includes gloves to protect your hands from allergens, contaminants, and potential zoonotic agents, a lab coat, gown, or scrubs. These protect both you and the animals by reducing the transfer of particles or pathogens. Masks or respirators may be required in some areas, especially if there's a high risk of allergens or airborne exposure. Eye protection, such as safety glasses or face shields, may be necessary in zones where splashes or contact are possible. Shoe covers or dedicated footwear are often needed to prevent carrying contaminants in or out of the area. Always remember, PPE must be removed before you exit the animal area to avoid contamination outside. Follow all posted signage and standard operating procedures. These are in place to guide you on exactly what is needed in each space. If you're ever unsure about what PPE is required, ask the facility supervisor, or refer to the posted instructions. One of the most common occupational health risks in vivarium settings is exposure to laboratory animal allergens, often abbreviated as LAA. These allergens are typically found in animal dander, urine, saliva, and bedding. What's important to understand is that allergic reactions can develop gradually over time. Even if you don't have allergies right now, repeated or unprotected exposure can lead to sensitization. To prevent this, we emphasize a few key practices: proper handling of materials and animals to limit airborne allergens, minimizing exposure by spending only the necessary time in animal rooms and using equipment as directed, reporting symptoms early, like sneezing, coughing, itchy eyes, or rashes, especially if they occur after time spent in the vivarium, using masks and ventilated equipment, such as downdraft tables or ventilated racks, whenever required based on your risk assessment. Remember, protecting yourself from allergens is not just about comfort, it's about preventing long-term health issues. Your awareness and early reporting can make a big difference. Let's take a closer look at animal-related allergies, which are one of the most common hazards in a vivarium environment. Allergic or even asthmatic reactions can occur, especially with repeated exposure to animals like mice and rats, which are the species most associated with workplace allergies in research settings. It's important to recognize the early signs and symptoms, which may include runny nose and sneezing, eye irritation or tearing, wheezing, shortness of breath, or asthma-like symptoms, red, bumpy rash, often on areas like the neck, forearms, or face. And most importantly, these symptoms can worsen if not addressed. Even if you're only entering animal areas briefly, repeated exposure without protection can lead to sensitization over time. If you begin to notice any of these symptoms, please don't ignore them. Report them early to occupational health so that your risk can be evaluated and managed, which might include adjustments to PPE or your duties. Prevention and early reporting are key to keeping yourself safe. In addition to personal awareness, supervisors play a key role in protecting staff from developing animal-related allergies. Supervisors should be aware of two things. First, the potential for allergies among their team members, even if no one has reported symptoms yet. Second, the workplace factors that can increase or reduce exposure, such as air handling, cage changing frequency, cleaning schedules, and how PPE is used. The most effective way to manage allergies is simple: minimize exposure to the allergens. This means using proper PPE, working efficiently in animal areas, and following good hygiene practices. Two easy habits go a long way. Wash your hands frequently, especially after touching animals, cages, or bedding, and avoid touching your face, especially your nose, mouth, and eyes while inside the vivarium. These small actions can prevent allergens from entering your body and triggering a reaction, and they also set a standard of professionalism and care in these sensitive environments. Before entering any animal facility, there's one key requirement we want to highlight. You must complete a health and risk assessment form. This is required for anyone, whether you're part of facilities, custodial, or technical support, if your duties bring you into spaces where animals are housed. You can find the form linked here as Health and Risk Assessment, and once completed, you'll email it to IACUC@usf.edu. This helps our occupational health team review any potential health concerns that might make exposure to allergens or zoonosis risky for you. We also encourage you to review the brochure titled Risk of Animal Allergens. It gives a simple visual overview of the common allergens, symptoms, and tips for prevention. Both the form and the brochure are available in your course materials, and you can always reach out to the IACUC office if you have questions about completing them. Completing this step ensures we're being proactive about your safety before you ever step foot in the vivarium. Another important topic when working around animals is the risk of zoonotic diseases. These are illnesses that can be transmitted from animals to humans. Some examples you might encounter in research environments include Q fever, LCMV, lymphocytic choriomeningitis virus, ringworm, which is actually a fungal infection, not a worm, and even tuberculosis, depending on the species and circumstances. While these cases are rare, prevention is critical, and that starts with basic hygiene and protective habits. Always wear gloves when working in or around animal areas. Never eat or drink in spaces where animals are present, even briefly. Wash your hands thoroughly after handling equipment, touching surfaces, or leaving the animal area. And importantly, if you notice an animal appears sick, report it immediately to the veterinary staff. They are trained to assess and isolate potential cases before they become a risk. The image here shows an example of ringworm, which can appear as a red, circular rash. It's easily transmitted through contact, but also easily preventable with PPE and proper handling. Zoonotic diseases are another reminder of why following SOPs and staying vigilant protects not just you, but the entire research environment. While much of our focus has been on biological and allergen-related risks, it's just as important to consider physical and ergonomic hazards in animal facilities. Many of you will be moving carts, equipment, or even heavy racks, and these tasks can lead to injury if not handled correctly. Here are a few key tips to protect yourself. Use carts or lifting aids when transporting heavy or bulky items. Don't try to carry them by hand. Ask for help when lifting large animals or cage racks. Never lift alone if it feels like too much. Try to adjust your posture or workspace to avoid repetitive strain, especially during tasks that involve reaching, bending, or pushing. And most importantly, if you begin to feel any discomfort, soreness, or notice a strain, report it early. Don't wait until it becomes a bigger issue. Early action is key. By taking a few extra moments to assess how you're lifting or moving items, you can protect your muscles, joints, and long-term health. Sharps injuries are among the most common and preventable lab hazards. Sharps safety is a critical aspect of working in animal facilities, and one that applies to both research and support staff. Sharps include needles, scalpels, and even broken glass, anything that can puncture or cut the skin. Always dispose of these items immediately in a designated sharps container, like the red bin shown here. Never place them in regular trash or leave them lying around. And remember, never recap needles. This is one of the leading causes of accidental needle sticks. If you experience a needle stick or laceration, don't panic. Wash the area thoroughly with soap and water. Report it immediately to your supervisor or occupational health, and seek medical attention right away. Don't delay, even if it seems minor. Quick action can make all the difference. These steps help prevent infection, exposure to hazardous materials, and ensure proper follow-up for everyone involved. Practicing safe handling and quick reporting is not just good practices, it's your responsibility. Let's talk about what to do if something goes wrong. If you're injured, exposed, or develop a laboratory-related allergy while working in the vivarium. If you're ever injured or exposed while working, don't delay. Your safety comes first. There are a few important steps to follow right away. Notify your supervisor immediately. This ensures someone is aware and can assist if needed. Fill out an incident report. This documentation is critical for follow-up care and institutional tracking. Visit occupational health, or if the situation is more urgent, go to emergency care. Your well-being always comes first. Be sure to know your emergency contact numbers, both for yourself and those you may need to reach out to. Finally, if treatment or evaluation is required, contact workers' compensation. They can guide you on seeing a primary health care provider for counseling, care, or further treatment. We know this may feel like a lot, but the key message is simple. Speak up early, document what happened, and seek help promptly. The institution has resources to support you. Use them. When something goes wrong, having that info makes a big difference. Now, let's talk specifically about the Occupational Health Program for those working under the IACUC. This program is essential for ensuring that all individuals who may have direct or indirect exposure to animals, animal tissues, or associated hazards are adequately protected. Here are the key components. First, complete the annual health screening questionnaire. This is a requirement for all personnel with access to animal facilities. If your role includes working with human specimens, OSHA's blood-borne pathogens BBP standard applies. You must have BBP training and be offered the hepatitis B vaccine as part of your safety protection. Before working with certain high-risk categories, such as non-human primates, zoonotic agents, or anesthesia, you must be medically cleared by occupational health. It's also important to keep your tetanus vaccine current. This is required every 10 years. And finally, for those required to wear respirators, you will need to complete a respirator fit test to ensure proper protection. These steps are in place to protect both you and the animals and to maintain compliance with institutional and federal standards. Environmental services staff play a crucial role in supporting the health and safety of animal research environments. Here are some key considerations. First, follow all biohazard and bedding disposal protocols to avoid contamination or exposure to allergens or infectious materials. Use appropriate disinfectants and be trained on proper spill cleanup procedures to ensure both staff safety and compliance with facility standards. When handling cage wash areas or using autoclaves, always follow safe handling procedures for chemicals and equipment to prevent burns or chemical injuries. And finally, respect posted signage and access restrictions. These are in place to protect staff and animals and ensure proper containment of potential hazards. Everyone entering the vivarium plays a part in maintaining a safe and compliant environment, including those supporting services. Before we wrap up, here are the key contacts and resources you should know. If you experience a serious injury, call 911 or seek immediate hospital care. For work-related injuries, contact Amerisys at 1-800-455-2079 and complete the Consolidated Injury Illness Report within 24 hours. For general safety issues, email Environmental Health and Safety at ehs@usf.edu. For any concerns related to animal use or occupational health requirements, reach out to the IACUC Program Office at 813-974-0954 or iacuc@usf.edu. Lastly, make sure you know the emergency numbers and the locations of first aid kits at your specific facility. These resources are here to support your safety and compliance. If you have any questions, concerns, or need support related to the IACUC Occupational Health Training or Animal Program compliance, please don't hesitate to reach out to the IACUC office. You can email us at iacuc@usf.edu or call us at 813-974-0954. We're here to help ensure your safety and success in the animal research environment. Here's our IACUC team at USF. If you have questions, need help with protocol submissions, or want to report any concerns, feel free to contact us. Farah Mulvey, Assistant Director, handles overall program coordination, compliance, and concerns. Andy Mackley is our Senior Research Compliance Administrator, providing support with protocol reviews and regulatory guidance. Jamie Cordery is our Research Compliance Administrator, assists with day-to-day coordination and researcher support. You can also visit the links below for more resources and forms. The dedicated IACUC staff are available to support you with your research needs and compliance inquiries. Please feel free to seek guidance or assistance at any stage of the process.